conference of the provincial government for the current new year. We'll hear a press statement, a report from the Premier about the COVID-19 in the province, and then we'll take questions. We have journalists that are joining us on Microsoft Teams, and there are also MECs and officials who will be joining us, and we'll be able to take some questions from those journalists. So if we can please start, Premier, with the media briefing. We'd like you to take over the podium, as you may. Thank you.
Thank you very much, Mr. Squesha. Good afternoon to you, and good afternoon to all the media houses present, and our colleagues, and the special advisor, Dr. Mbengashe. I normally hear that if you are putting a mask, you might be disadvantaging other people who don't follow what we're saying. If I'm allowed, I can try to put it off a bit. Thank you very much once again for joining us in our first media briefing of 2021. Firstly, on behalf of the Eastern Cape Provincial Government, I wish to extend compliments of the New Year to you members of the media present here and to all the people of our province. We are grateful that many of us survived what has been a very grim year 2020, but we are mindful that others have already lost their loved ones in this new year. Sithathela ithuba ke sigqithisa amazwi ovelwano nentuthuzelo kusapho lakwam Thethandaba ne-community yakuQumbu ngesehlo sokulahlekelwa kwabo ngutitshalakazi umama uZininzi Mthethandaba emva kokuhlaselwa kwakhe yinkomo. Lento isasikhwankqisile sonke, kwaye siyacela ukuba abantu bangayenzi into yokudlala kumakhasi onxibelelwano. Life has been lost here. Ela khaya malinikwe ithuba lokuzilela ilungu losapho lwalo ngesidima, and the government is working on that to do all the necessary tests, particularly on the cow itself, to ensure that we ascertain what the problem is scientifically. Sikwagqithisa amazwi ovelwano nakwiintsapho zabakhwetha abathathu abadutyulwe kwilali yaseJojweni eTsomo. Noko ezi zinto zisishiye simangalisiwe. Siwathembile kamapolisa kuba sele esibonakalisile okokuba xa ebeke u-72 hours bayakwazi ukuyenza loo nto kwenzeke. Siyayazi into okokuba sele umkhulu umsebenzi abawenzileyo wokuzama ukurhanqela abarhanelwa nabatyholwa nokufumana isixhobo eso esithe sasetyenziswa ukulimaza aba bakhwetha. Kanjalo sikwagxeka into yokutshiswa kwabantu esiyibona apha kumakhasi onxibelelwano phaya kulaa lali yaseBhazia eMthatha ngenxa yokuba berhanelwa ngokuba imfuyo. Sonke siyavuma ubusela bemfuyo abamkelekanga kwaphela kwaye lulwaphulomthetho. Kodwa bantu bakuthi yekani ukuthathela umthetho ezandleni zenu de kwenziwe isikizi elinjengeliya nabantwana abancinci bebukele. Sakha isizwe esinjani. Into engalunganga zange yalungiswa ngenye into engalunganga. Siwabonile uba amapolisa besefikile pha ekhona. Noko amapolisa xa sefikile siyacela uba abantu banike umthetho udlale indawo yawo. Our biggest wish for 2021 is good health for every citizen of our province, because without good health there can be no better life for our people. After all, it was an anti-colonial activist, Mahatma Gandhi, who once alluded that, and I quote, "It is health that is real wealth and not pieces of gold and silver," close quote. It is a matter of historical records that 2020 is a year in which the entire world was engulfed by the COVID-19 pandemic, which has thus far claimed the lives of more than 1.8 million people worldwide, with more than 30,000 of those lives lost in our country, and more than 7,000 of those lives lost in our province. These are not just numbers. These are people who were grandparents to someone. These are people who were called mom and dad by someone, and these are people who were children to someone. These are people who were relatives to someone, and indeed, these are people who were colleagues to someone. The loss of their lives is a scar that will forever remind us that we were once visited by this deadly virus which has caused this world pandemic and threatened to wipe out humanity existence. We continue to be encouraged by the people who test positive for the virus and recover from it. More than 161,000 people have defeated this virus in our province, and this should motivate people who are currently infected to fight hard to defeat this virus. We have faith that this year we will overcome the COVID-19 pandemic, and that working with the people of our province, we will begin a process of healing from the after effects of COVID-19, and more importantly, we will embark on a journey of rebuilding our lives. We are extremely aware that the process of healing and rebuilding lives that lies ahead of us will be difficult. But our strength as people is in our solidarity. It is in extending a helping hand to reach out to those of us who cannot stand or walk on their own. COVID-19 has left us with plenty of people who will need a helping hand. They are in families who have lost breadwinners to this pandemic. They are the small businesses that have been affected by the necessary regulations that were put in place to save lives. And they are the men and women who lost their jobs. Today I want to appeal to everyone of us as private citizens, government officials, church leaders, traditional leaders, business leaders, and civic society leaders, labor leaders, to be ready and willing to extend a helping hand to such fellow citizens so that they can stand and walk again. We've seen a phenomenal solidarity in action during our fight against this virus, with individuals and organizations voluntarily taking care of the vulnerable with food parcels and other essential supplies. We've seen sister nations, NGOs, and individual members in our society donating PPE to help in our cause of saving more lives. We must extend this humanitarian spirit to the task of rebuilding livelihoods. As we begin the new year, we are pleased to share with the people of our province that there is once again good progress in our fight against COVID-19. This is largely due to cooperation by our people who have once again adhered to COVID-19 regulations. If we continue to do that, we will be out of restrictions soon and more economic activity will be allowed. We only have to wear our masks regularly, wash hands and sanitize, maintain physical distance, and stay at home as often as possible to stop the spread of this virus. That is not too much to ask. The ball is in the court of our people to determine whether we remain under alert level 3 whether we move to alert level 5 or whether we move to alert level 1. Kodwa ke into ecacayo yeyokuba funeka amagosa ezomthetho eqinise ngakumbi ukunyanzelisa ukuthotyelwa komthetho. Kwi-roadblock ebendike ndakuyo ngomhla wama-31 kule igqithileyo inyanga enguDisemba, ndibonile uba abantu abaninzi beluphondo ngabantu abathobela umthetho, ngabantu abahlonipha umthetho. Siyayibulela kakhulu loo nto. Kodwa sisenayo imbinana yeminqandandana phaya naphaya yezaphula mthetho. Siyafuna ke into kokuba nabo bengekaqondi beqondiswa babone kuba ixesha esikulo lixesha lokokuba kungabikho abantu abadlalayo ngobomi babanye abantu. I want to commend our law enforcement officers for their sterling work of enforcing regulations. On the 31st of December, 177 non-compliant liquor outlets were issued with fines to the value of more than 188,000, and 1,532 people were arrested for non-compliance with regulations. Ekuqaleni kwenyanga kaDisemba besisekhaleni kutaka inhlanzi ze-COVID-19 kwizithili noomasipala abambaxa bethu Nelson Mandela, your Buffalo City, your Sarah Batman, your Christiani, Amathole, Owar Tambo, later on joined by Alfred Nzo as well. At that time, our newly diagnosed cases were standing at about 1.2 on average, and we had over 8,000 active cases. This was largely due to a bad human behavior, and we went back to the drawing board to enforce compliance in the form of a differentiated approach to the management of the pandemic. Our call to those to close beaches, our advocacy on mandatory wearing of masks, and our ban on large gatherings have yielded positive results. Our call to close beaches, our advocacy on mandatory wearing of masks, and our ban on large gatherings have yielded positive results. These were further boosted by the imposition of a new curfew and ban on the sale of alcohol. We really thank the National Coronavirus Command Council for that leadership. We did not take these decisions lightly. We took them in the best interest of saving lives, and that, for us, supersedes everything else. Through these measures, we have reduced active cases in our province from 8,000 at the start of December to about 5,000. Our recovery rate is now at 93%. We are quite happy with that progress as well. All our districts are back to the recovery rate of 90% and above. These are strong signs that we are moving towards the end of the second wave. We're doing our level best to really plateau, to really level the curve. And the work that we're doing on the ground is actually seen out of these outcomes that I'm talking to. We, however, remain cautious because of the uncertainty in achieving personal behavior to adhere to regulations. Hence, we insist that mandatory wearing of masks should continue to be enforced, that our people must continue to social distance, wash their hands, and stay at home. We are also acutely aware of the risk posed by the new COVID variant. In this regard, we continue to protect and strengthen our healthcare system to withstand any form of demand. In the implementation of our provincial resurgence management, there are no red flags that should cause our people alarm. We are concerned about the circulation of misinformation in social media about shortage of beds and oxygen in our health facilities. There is absolutely no truth to such claims. They are just causing our people unnecessary panic. But we want to appeal to our managers of hospitals, our CEOs. Sometimes you get into an hospital, you hear this story, but you only find out that these things are there in the storerooms, but the management within the system is actually causing this kind of chaos. Be it PPE, so these claims keep on coming. So we would want to really urge our managers to really be agile on this and always act decisively. I've told the MEC and HOD that on all these, whether malicious or not, but we must have consequence management. We can't have people who continue misleading the society, who continue spread lies for purposes of really portraying our government as bad and caring government. The oxygen status in our hospital is in the top level of stability. The medicine status is in the same level, and that is the same for PPE status. There is PPE in our hospitals, and people are given PPE according to areas where they work. And we want to make sure that no worker must go to work without PPE. We rather deal with workers who are not prepared to work because they are not given PPE in the health side. So it's going to be important that we work together. That's why we have set up structures and mechanisms in the province that where you see such, report it immediately so that even Premier himself can immediately make a follow-up and find out why there is no PPE in that. So on all follow-ups that we've been making, we realize that there is PPE. So we have a lot in terms of really looking at our management system and in ensuring that our institutions are also properly led. On the matter of bed availability, we are at an increased level of stability, meaning there is no shortage of beds in our hospitals. For instance, we have 4,309 general COVID-19 beds, and our admissions are at 1,788. So there are more than 2,500 beds available. We also made available 637 critical beds for COVID-19 patients, and only 160 are occupied, meaning 477 are available. I must add that only 49% of our oxygenated beds are occupied. So there is no truth to the shortages of oxygenated beds either. We wanted to reiterate that all the regional and tertiary hospitals, including the renovated old Cecilia Makiwana and the Volkswagen South Africa Field Hospital, have wall-mounted oxygen points and the bulk oxygen tanks, which are kept operational 24 hours. Monitoring of tank supply are done by the telemetry online system by AFROX. The installation of wall-mounted oxygen points in Statarem and St. Barnabas Hospital is planned for commissioning this month. Mabuyane, KwaZulu, and Midlands Hospital are also under consideration. We have done this already in a number of our district hospitals. These actually bulk oxygen tanks are already existing. The most critical resource to help COVID-19 patients when they are admitted in our health care facilities is our health care workers. They bear the most brand of COVID-19 in the front lines every day. They work long hours, and they have seen the worst that this virus can do. To alleviate this pressure on them, we have appointed 310 clinical staff who have completed their community service. In addition, a further 625 professional nurses will complete their community service training in April and will be utilized on the front lines. We have a challenge in the market of getting nurses, especially those who can mend the critical care beds as well as the ICU beds. So we are working very hard to really make sure that these issues are addressed. I've told MEC and HOD that we must actually replace the permanent posts of nurses that are either retiring or are getting out of system for various reasons. We can't have that one delayed because we need nurses, and part of the reason that we're struggling to get nurses, no one is prepared to leave a permanent job for a contract job. We welcome the announcement by the Minister of Health to bring forward vaccine procurement availability and the start of vaccination for healthcare workers as a priority, the elderly and vulnerable groups, as early as February. There are people who are recklessly spreading falsehoods about vaccine without any share of knowledge about vaccine, telling our people that they should not take a vaccine when it arrives. I think it is about time that our law enforcement looks into such people seriously because they pose a threat to the health of our people. Our people should trust government as the only credible authority on vaccine and the process that will be followed to roll it out. We will ensure that our staff are trained to achieve a rapid rollout of the vaccine. We will also work with all critical stakeholders to ensure the effective rollout of the vaccination program to stop the risk of a third wave and ease economic disruptions and social impact caused by the stringent regulations. We will henceforth set up a provincial coordinating committee as required by national for the vaccine rollout to advise us on technical, social, and ethical issues related to mass vaccination of our communities. We want to assure the people of our province that our mandated interventions on vaccine and vaccination will be guided by science. We will follow ethical principles and we will ensure rapid implementation to achieve the required level of the herd immunity to prevent COVID-19 transmission and to achieve containment levels towards total elimination of the virus by the end of 2021. The restriction under alert level 3 meant the closure of the traditional circumcision season in our province. We agree with our traditional leaders that the December season is closed and what remains now is to bring home safe all the boys that have undergone the rite of passage to manhood. Our monitoring teams are hard at work with the traditional leaders to monitor all the boys that have undergone this process. When they come home, there will be no festivities because that could lead to new infections. Sichilo ba social gatherings, imicimbi, imigidi, njalo njalo. Sinoloyiko lokokuba zingadala usasazeko lwale ntsholongwane kakhulu. So siyabacela ke abantu sesibacelile savana into yokuba amakhwenkwe makahlanjwe, abuyiswa yalwe ngexesha elifanelekileyo ukulandeliswe imigidi yabantwana ukuzalisekisa isithethe sethu. Our teams have tested 4,878 initiates for COVID-19 and 239 returned positive. Returned positive results and were placed under isolation measures. Sadly, we lost 11 initiates to a variety of complications that are not associated with COVID-19. Ayamkelekanga lento yoba sibe nabantwana abasweleka kuba be-dehydrated. Kudala lento siyithetha yokokuba akukho ndithi abantwana mabanganikwa amanzi. Abantwana bangoku abafani nabantwana bangaphambili. We are all subjected to ukutya okulula kwala maxesha. Abantwana bangaphambili siyayazi ba imeko ezinje babekwazi ukumelana nazo. So siyacela into yokokuba iingcibi abantwana bona uqobo lwabo babakhona bangafuni ukusela amanzi ngokunokwabo ngenxa yokuba besithi bafuna ukubamba isiko. Siyacela uba abantwana bangayenzi loo nto. Ndikhathazeke kakhulu apha evekini xa bendihambele ikhaya lakwaGolela phaa edutywa eliluze umntana walo obesenza ugrade 12, a rugby player. simply because the boy was dehydrated. Father has done everything. Father has been there. Father has been supporting the child. I really felt so bad. Even the day that the boy passed on, Father was there from 8 a.m. until 1300 hours. But the boy, after 4, was almost succumbing to this dehydration. Utata wakhe wamnika ngokwakhe amanzi at some point ukuqinisekisa into okokuba xa esiva uba ingxaki ngamanzi umntana uyawafumana amanzi. Siyacela uba le mcimbi wamanzi siwunyanzelise abantwana bakwazi ukunikwa amanzi afanelekileyo alingene ukunikwa abakhwetha, so that singabi nabo abantwana asibaluzayo ngenxa yezo zinto ezinjalo. We pass our deepest condolences to all these families. These are deaths that should have not happened. These are deaths that should have been prevented. Lento ithetha ukuthi usemninzi undonakele ekufuneka siwulungisile singurhulumente kulo mcimbi wolwaluko. Sibambisene neenkosi nabazali babantwana abaya esuthwini. Ndithetha nje kukho abakhwetha abangamashumi kwizibhedlele zethu. Bengeniswe zizinto ekungafanelekanga ukuba zenzekile xa besiliqhuba kakuhle elisiko lolwaluko. Siyacela, siyangxola, siyakhalima kwakhona abantu abangamadoda bonke mabayidanele into yokusweleka kwabakhwetha nokusuka kwabakhwetha ezibhedlele. Kanye xa ndilapha mandoleke ngokukhalimela into ethe ndi yabantu abomba abantu abangcwatyiweyo. Phaa kwi-social media sidibana ngezinto ezithethwayo into okokuba bakhona abantu abomba abantu abangcwatyiweyo ngeemeko zeenkolelo ngeenkolelo, ngenxa yemeko yokokuba sisazi uba abantu abangcwatywa kakade kwiindawo esisuka kuzo bombathiswe ii-plastics. But phantsi kwemeko abantu abaswelekela kuyo yesi sifo, urhulumente wabona kufanelekile uba ukukhusela ukusasazeka kwesi sifo makuqwalaselwe loo mcimbi. Ndicelile ke apha esebeni okokuba masiyijongele kufutshane le ngxaki, sikhangele indlela esinokukhawulelana ngazo nabantu nezixhobo ezinokusetyenziswa ukuqinisekisa uba laa nto ibinokwenziwa yiplastiki ikhona enye into enokwenziwa ngayo, khona ukuze xa kukho isikhalo ebantwini sokokuba abantu xa bengcwatywa neplastiki bayabuya bekhalazela izinto ngezinto njengoko sisazi belele nje basathetha. Abantu bakuthi ke bayakholelwa kakhulu kuloo nto, kodwa siyabacela abantu bakuthi bayazi uba kukho umthetho omiselweyo we-exhumation. Xa ufuna ukomba umntu osengcwatyiwe kukho imithetho nemigaqo elandelwayo. Uba ikhona le nto siyivayo isasazwayo phaa kumakhasi onxibelelwano, siyacela, siyanqanda, siyacela abantu baze ngaphambili xa kukho ukuxakaniseka kweento ezinjalo, sibonisane sithethe. Nabacinga uyenza loo nto mabangaqali ukuyenza kuba bazawusenzela enye ipandemic esingayilindelanga yokusasazeka kwezifo, kuba sisazi uba umntu nje noba ebengena coronavirus akungcwatywa loo mntu u-infectious kakhulu. So siyacela ke ba abantu bayihloniphe le nto. So siyayikhalimela ke loo nto uba mayingenzeki uba ikhona into engathi ifuna ukuyenza. Lastly, the marking of grade 12 exams papers has started in our province. The Department of Health has conducted testing in all marking centers since Saturday, when the chief and senior markers came to prepare venues for marking. Positive cases have been managed by the Department of Health, and Department of Education has sent in replacement markers, and all people are undergoing the same testing. We have encouraged all markers to stay in the marking centers precinct for the entire period of marking so that no one may bring infection from outside. The Department of Education will be responsible for daily screening of symptoms and providing a sick bay for positive screens to be taken over by Department of Health. As part of our precautionary approach on the marking for grade 12, we've conducted screening and testing of all our markers. We've tested 2,310 markers already at the marking centers in the province, and 79 people tested positive for COVID-19. All those who tested positive will receive psychosocial support from government, have been isolated and will be kept in isolation until they recover. We wish them speedy recovery. Tracking and tracing of their contacts has started. We are hopeful that the class of 2020 will defy the odds that were stacked against them when COVID-19 hit our shores. They studied under very difficult circumstances, but with the support of their teachers, they will prevail. We want to send our heartfelt condolences to the former member of the provincial legislature who represented the Democratic Party and later Democratic Alliance, Mr. Eddie Trent, who passed on recently. We wish his family strength and fortitude during this time of mourning. We thank him for the role he has played in the shaping of our multi-party democracy and building the province to be a better place through the work he did in the opposition benches of our provincial legislature. We welcome MECs that have been in isolation, MEC Gomba, back, MEC Fundile Gade, MEC for Education, MEC Spogazimani Lucid, MEC for Social Development, who have since recovered from COVID-19. These MECs are fully back at work and are working remotely. We also send our heartfelt condolences to the Gomba family for the loss of MEC's Gomba mother. Umama wakhe ebena 92 years. Uye lanikezela iqhegwazana siqethisa amazwi ovelwano kakhulu kula family ngokokuba baphulukane neso sisele senyati. We wish the family strength during this mourning period. Thank you very much.
Thank you, Premier. We will now take questions from members of the media. Let's start with those that are here, and then those that are joining through Microsoft Teams can just raise their hands here or write in the chat box. Then we'll give you an opportunity to ask questions. We will not be able, fortunately, we won't be able to have time for one-on-ones with the Premier, so we'll give you a chance to ask the questions now. Abongile? Okay, Abongile, let's go.
Happy New Year to us all. Premier, even though there's a 90% recovery rate and the numbers are slowly declining in the province, but the death toll remains a bit high compared to other provinces. What can you attribute to that? That's all.
Okay. You want to take that, or let's take the younger first?
No, he has covered my question.
Okay. That's the only. Okay, let me take with JJ. JJ, you can come in. JJ, can you hear me? Okay, let's keep you. If you can please answer the.
Well, both Dr. Zungu and Dr. Mbengashe, the special advisor next to me, can give more kind of a scientific analysis around that. But what we know, these have been attributed to the challenge of comorbidities. Most people that were losing are people who have comorbidities. It's not just people that were losing so easy. But as we indicated in the last briefing, that we have also asked our local universities, particularly those that are also in the medical science space, to help us dig deep. We need more empirical evidence around this so that we don't just continue making it as easy as that is an issue of comorbidities. But clearly, we have not lost people who have no comorbidities. So we have seen how vicious this virus is in those people with comorbidities. So that's a challenge that we have. And we knew the challenge of the health profile of our people. We've indicated that upfront because everyone knew that there is no cure, there is no medication for this. We can only deal with all these other issues. But also, the challenge of our people staying at home longer. I know, especially in this second wave, many people preferred to isolate at home. Many people preferred to quarantine at home, unlike what we tried to do in the first phase, where we were almost kind of forcing people for quarantine and isolation. So we still believe that there's some gaps there in terms of discipline on individual. The issue of the social behavior becomes clear. And we've been making this plea that we know that as much as we are all susceptible to the virus, but older people are more vulnerable, are more risky. The more we allow them exposed to this, it's going to be a challenge. And many of them are not loitering, are not all over. They are staying in their homes. But young people, we really want to appeal. We can't really continue really observing this juvenile delinquence of some sort, this behavior. It has to stop. That our young people must understand that for them to remain with grandmothers and grandfathers, they must take responsibility. The unfortunate part or fortunate part to them, this COVID-19 is not really doing damage that much to them, but we are already seeing signs of losing also young people, but still young people with comorbidities. So we really very much concerned as a province around the numbers. Indeed, the numbers are really worrying us. They are growing. We've been on average of 100 and above for almost 2 weeks now, observing that situation. We are losing our people. Our people are dying. The only way that we can do to stop our people not to die is to get everyone at home, no one out, no one loitering. At least you do all these non-pharmaceutical protocols. Stick to them, be disciplined, respect them. You must know that as they say, the more you move around, the more you allow this virus to be actually in motion. The only way to fundamentally disrupt the transmission of this virus is to be disciplined, is to be at home, is to observe that. So we are really losing older people, and this is another challenge. Many homes will be soon child-headed households because families have gone, families have been perished. So we really want to plead, we really want to appeal that let's take response, not only for alert level 3, 14 days intervention, but let's actually internalize the issue of responsibility. Wherever you go, you must know that you might be applying for decimation of your member of the family. The fact that you are out there and you want to satisfy your own interest as a young person. So we really want to appeal to young people to take responsibility. These are our future leaders. You start now. So we expect them to really understand this call that we're making, that this country without them, it won't actually have its future that is intended. So the issue of deaths, it's concerning, it's really up. We almost topping every province, and our people are dying. So we are really concerned. Many other people are dying at home. Yes, we've actually put in place a system of taking swabs posthumously, that even if someone has died at home, that must be done. That's work that health is doing to verify all such kind of information, which is quite critical for us to understand. We're doing it also to protect those who are still alive, so that you don't sit at home and say, this was not a COVID case, it was a natural death. You want to do a normal funeral, only to realize that you are risking everyone around. So that's why we are really making this plea that funerals must comply to the regulations, manage them, keep them into the kind of parameters that have been set up, because we're protecting these other people who are still alive. We don't want funerals that must have follow-ups of trail of death simply because people attended. Elder people must be cautious about attending funerals. You can come back tomorrow, even if that was a very close-knit family. You can let it go, come back, so we're really pleading. Siyabacela kakhulu abantu emakhaya lemicimbi yemingcwabo ezilalini siyayazi bakunzima ezilalini ukwenziwa kwale mingcwabo esithi mayenziwe eyi50, Ndiyavuya nangoba kumngcwabo ebendikuwo namhlanje apha eNgqondorheni kusasa nje umngcwabo was just fully compliant. Yonke into yenziwa ngokwe-protocols and umngcwabo ubusezilalini waqhutywa kakuhle, yonke into yenziwa ngendlela efanelekileyo. So intsebenziswano phakathi korhulumente nabantu, sicela neenkosi, bendine-meeting neenkosi zonke zase-Eastern Cape izolo, apho sisenza khona elikhwelo okokuba laa system sinayo ye-traditional leadership siyayazi bi-effective apha eprovinsini, isebenza kakhulu. Laa miyalelo isuka ezinkosini ibheke ezibhodini njalo njalo, mayiqhubeke laa system isincedisa kuba xa into ixoxwe ebhodini kwavanwa ngayo, akukho umuntu ofane elalini aphume ecaleni enze enye into. Nasezilokishini izi-street committees zethu njengoko usazi into okokuba we also activated our operation Masiphathisane service delivery model. So those ward-based war rooms are meant to assist our people reach out, give all the necessary support that is required during this time. Traditional leaders, civil society, NGOs at that level working together. At a local level, our local command councils. At a district level, our district coronavirus command council working. All of them working together with the provincial coronavirus command council. So we're really pleading, we're getting that system in place, and it has been working. We've seen it. That's why we are able to extinguish fires easily where we see some outbreaks. I'm not sure, Doc, if you'd want to elaborate more on this issue of deaths. You can come in.
Maybe, Doc, you should also take the question from Rahel on the vaccine that I sent to you.
Okay.
Yes, you can move over there.
Thank you. Good afternoon. The Premier has covered quite substantially the issues of death. I'm just going to spend a little bit on the explanatory component of the science, why these things are happening. The key issue really is what is called the model of society, what contributes to the existing conditions within the society. One of the biggest challenges we have is that death in COVID have really been researched that they are related to age. The older you are, over 60, 65. The second one is the number of what is called the existing medical condition. If you have more than one, you've got more than three or more than four, your conditions are actually, the likelihood of dying are quite high. And the last point is that there is always a challenge that all the numbers of people we know that have caught COVID today, there are lots of other people who never really were recorded in our system, and therefore we don't really know what they are. So what then that has is that when we calculate the number of deaths, we usually relate the number of deaths on the number of people that are known to have been having COVID, and the ratio of that can actually go up or go down depending on the number of people that are known. So in our situation, especially with this recent COVID, is that we had a high number of young people who get infection. Over 80% of those individuals, they don't know they have an infection, they don't have symptoms. And those numbers are not visible in the counting. And when these people come home, then they transmit the infections to the elderly people that are there. And this happens because they don't have symptoms, they don't know, and the elderly people have no suspicion that they have got problem. The second biggest problem that we find is that there is an unfortunate view that if you go to hospitals, then people die. And this is not just on COVID. It's been a matter that has been in the older HIV and all that. So what people stay too long, and we have been measuring why we are saying that. If you die in a hospital within 72 hours, we now know that you took too long to come in. And those numbers are very growing, that most of the people actually, that people usually say someone died in a casualty, someone died while he's waiting for a doctor, is staying too long before you are actually there. We now know that if you come early, there's really a big development in terms of treatment. Oxygen makes a huge difference in terms of your survival, even when you're elderly. Secondly, if you start the steroids, which are dexamethasone, that makes a huge difference in terms of survival. And the third issue, we've got what is called non-invasive ventilation, about high oxygen. Those components actually deal well in trying to save lives. We are finding in our communities that there's a very late coming. Therefore, there is no benefit in the treatment protocols, and they are not actually getting the benefit of surviving. So we are urging people that don't stay at home, because the issue about whether you are very sick or not, it's very difficult to discern while you're at home. There is in science now, they know that some people who actually have got very critical oxygen levels in their bodies, they stay happy not knowing. And then when this critical level comes to a part where it has injuries in your heart, in the other system, and they suddenly collapse. So I think what Premier has raised is very important. The part of this science is also there. What the message is, come early if you are elderly, you've got diseases that you have, you are overweight, and you are unsure about where your condition is, because you can really benefit in the new treatment. We think that makes a major contribution in the excess death in the province. I'm just going to speak on the issues of the vaccine. I know that there was a question about vaccine and Aspen and the Johnson & Johnson initiative. The Premier has made a statement already that he will be visiting Johnson & Johnson and Aspen factory in Port Elizabeth. This is an important one. What's important on the vaccine is that most of the local companies like Aspen have really invested a lot of money, about over 3 billion, to build what is called a sterile manufacturing system, which is the requirement to produce good vaccine. 2, the filling of those little vials for vaccine, and 3, the actual making sure that the distribution of the vaccine is happening. So Johnson & Johnson is doing the research and is doing the clinical trials, and is actually making a provision to make sure that there's manufacturing. What we understand, we know that Aspen will probably be able, out of their investments, to get up to 300 million doses, which will be used in the country and also in other countries as well. This is important because the new way of developing vaccine, which people have really experienced, is that you no longer do what is called sequential development of vaccine. You develop the vaccine, it gets approved, and then you decide to manufacture. You carry those concurrently so that you can have a vaccine that is available much quicker. So we're very excited about the development of vaccine. We're very excited about the minister's announcement, which the Premier has made. And I just want to make a last point about the variant. I think there's been some media reports, and this came up from the British, I think it was a Minister for Health, who actually made an announcement that the variant in South Africa could be much more virulent than the one that they have. There is no science that supports that. What we know now is that the two variants are very close to each other in terms of how they have developed. The second part is that we know that the variant that we have is actually much more easy to transmit, but it doesn't cause a severe disease. And they have actually tested the idea whether the vaccines that we have will actually be effective against this variant. The science as it stands right now, these vaccines will be equally responsive onto this. We're quite lucky in the new ways how vaccine platforms have been developed, because the scientists can actually, what is called, create a bespoke virus, a vaccine, depending on what the virus gene system is. So if there's a genetic change in future on the variants, the change in the vaccine development will not take more than a few months to actually do that. But at the moment, there is no danger in actually doing that. I think I've answered the question, Spring. Thank you.
Okay, thanks, Doc. There are additional questions. This one goes to the Premier. From Kevin, it says, the Eastern Cape's infrastructure up to standard for the rollout of COVID-19 vaccine, are draft plans being put in place so the province is ready to the vaccine become available? That's the first question. Please, Lisa, we've got another question that you want to ask?
Yes, I wanted to ask the Premier, in terms of readiness, because we do know that as we're speaking about the vaccine, it also goes to indoor. There are so many skeptics out there when it comes to the effectiveness of the vaccine and how it's going to be rolled out. Is there a plan from the government of the Eastern Cape in terms of educating the people
Premier, Eastern Cape is the only province that was given green light for integration summer season. So my question is, why such a push? Because I believe, according to Dr. Ambassador Zuma, Premier, you as well as the leader of the traditional House of Traditional Leaders went to do the presentation to state the case that Eastern Cape have to be given a green light. My question is, why such a push? You know, and now we're to sit on this dilemma where this whole thing has to be stopped. And my second question is, what if the second wave prolongs over winter season? Will you have guards to go back to national government to be given green light again? You know, and what are you saying on that?
Thank you very much. The Eastern Cape infrastructure capacity, I think this is a question that we kept on talking to on the now rollout of the vaccine. We are not dealing with these infectious diseases for the first time. There's been diseases like this before. We had TBs, we had all these, and the government is always able to respond and rise to the occasion at that particular point. I repeat, no country in the world that was prepared for this, because it's unprecedented. It was unforeseen. But what is important is agility of government. That's why minister has outlined the process and also indicated to all provinces that you must begin now to prepare yourselves for this eventuality. So Eastern Cape, like any other provinces, is working on that, and we will be able to address that. At a time when our people will be vaccinated, Eastern Cape people will be vaccinated, just like any other people in South Africa. That system will be responding to that. We are in this country, we are part of this country, we will be working with national, but Eastern Cape, just like any other province, will be ready and will be capable to roll out the vaccination at a point when the country is doing it. So I repeat it, you can go anywhere in the world, first world economies. This has been a challenge, this has been an issue. So it's not just an issue of an isolated province, etc. But I can tell you, we will be ready, we will be able to vaccinate. You can't find a situation where people of Eastern Cape won't be vaccinated. Immediately that arrives, the frontline workers of this province will be vaccinated at the same time with others, as long as the vaccine will be available and will be allowed to be rolled out in the province. The question of skeptics, that's a worrying. I think that's a point that we're addressing, that people who are peddling lies, and people who are creating this perpetual uncertainty, it's worrying. It's something that we're really condemning in strongest possible terms. We know that even in the past, that would have been an experience for anyone who's not sure. And a lot of things are said out there, but we are appealing to our people that at a point this vaccine is available, our people must ready themselves. Take responsibility about your life. Stop listening to all other people who are saying things out there. The same people will go and vaccinate themselves and get the vaccine. So we want to appeal to our people that government is doing it slowly but surely. We definitely want to do what is right for our people. We are not going to act under pressure because it is being done in US, it is being done in London. We must adapt it to our material condition. It must respond to the needs of our people. That's why government nationally is actually working on, and that's what Minister has explained to all South Africans. Let's support that process. Let's support that initiative and make sure that government does the right thing. The issue of initiation, we were never put under any pressure as government, I must indicate. We've been working together with our stakeholders on this issue of COVID-19 from the day one. We couldn't have initiation in June. Our people understood it, that this is a challenge. At a point when we were agreeing, our numbers were actually relatively low. We only experienced the second wave when we have almost agreed on this. That's why we have said, let's do it in a risk-adjusted approach. Where you have got high numbers, don't take chances. That's why we couldn't agree on Nelson Mandela and Sarah Batman, because this is where this actually resurgence was actually showing its ugly head. Yes, it actually spread across the province in the process. That's why at a point when we saw it now, that it is almost all over, then we said, let's stop it. Because it's about protecting lives, it's about limiting any risk that these young people can be exposed to. If in June we will have high numbers, there can't be initiation process, and everyone understood that. But if numbers will be low in June, there will be an initiation process. We have stopped it now because we have seen this actually surge. We're almost peaking as a province, and now we are on the decline. We would wish to see this being sustained, as we have been seeing that it has been sustained for almost over a week or two. Moving forward, we hope that that kind of plateauing is what we are going to be observing, and that leveling of the curve is what is going to be the order of the day in our province. In April, because National Coronavirus Command Council meet regularly, reviews regulations, takes decision in the best interest of our people. Yes, there were complaints, because in the province we had almost more than 44,000 boys who were ready to go for the circumcision that couldn't go in June. That's why we felt like it's important that we look at that issue under a very risk-adjusted approach. On the other question that Dr. Mbengashe was explaining, as I conclude, kulende comorbidities, uyakhumbula uba le province yethu is one of those labor-sending provinces, especially in the mining sector. Part of the challenge that we have been experiencing out of this virus has been the challenges of the respiratory challenges, difficulties of our people. What we've been working on, you understand, all of you, what these, from the asbestos and other things that our people have been exposed to. So the bulk of people in the country who were exposed to these, the respiratory risk diseases, even in the mining sector, are people from this province. So we should really not be surprised when we see these issues. But what we are trying to do, siyayazi abantu bayakholelwa kufutheni, abantu bayakholelwa kujenga uDokwe besitsho njalo njalo. Ewe, continue steaming. It's important to steam. We have seen it, many people saying it. But you must be able to be in the hospital, especially if you know that you have got comorbidity, so that we can help you and assist you monitor yourself, monitor your oxygen. On a, we've done in almost every the hospital. Yes, of course, when our numbers were going, because even our development in the province is skewed more on the urban and metro side. As you move, yes, we do have beds. As you move inland and in the rural setup of the province, we do have beds, and we have since moved from the first wave, where we took decisions that we're not going to build field hospitals in abstract. We are going to look for legacy programs for this COVID. We're going to facelift and rework the old dilapidating infrastructure in our hospital. And this is what we've done. We have now many other beds that are coming up. If you go to your SPAY 2, over and above the 500 million project hospital that we're doing that will be ready before June this year, we have also built additional beds which were in response to this. We have done almost beds in every hospital across the province. Where you go, you will find that in the last 6-7 months, we've built number of beds in the province to respond to this issue of COVID, and created the capacity of your high care as well as your ICU beds that have been actually not available in that other part of the province. So we have done our part, and we continue to do our work, and we are on the ground. We are alert. We continue taking advices, guidance, support. We appreciate that. Where people see things, let them report. We are able to respond to that. We are just trying to ensure that our government is agile, and our agility is going to help us to really tackle and deal with these issues decisively. We are done by our Shushwa.
Thank you, Premier. I think the last request we have is from the SABC, and they're requesting that you give them a toss-up right.
Thank you very much, guys. Thank you so much. Ufuna ntoni ngesikhosa? Udini yang? Njengoba sisitsho kwi-statement amanani ethu uqala kwethu uDisemba abephezulu kakhulu futhi ebede afika napha ku-14,000 uba ndikhumbula kakuhle amanani active cases in the last 2 months or so. Sasebenza after siqaphela into kokuba besi average kwinto epha ku-3,000 2,000 a day infections, daily infections. Sasebenza nzima ukuqinisekisa into kokuba sithumela ii-teams zethu phaya ebantwini koobhayi, sathumela i-van, kwatestwa bonke abantu, massive testing that was happening, and no longer the issue of testing the significant contacts, no longer an issue of about index, but just generally testing abantu bakuthi. So la manani athotywe ke ngumsebenzi ebesiwenza siqhubeka siyatesta, but siyabona amanani ke ayehla, siyayincoma ke loo nto kakhulu kuba ngoku ubuya sithelekisa namanye amaphondo i-active cases zethu zingaphansi kwi-active cases zase Free State, zase Limpopo, zase Northwest. They are at 6,000 and above, ezinye ke zikhulu, ezethu ziyehla because iplan ebesiyibekile iye yasinceda kakhulu ukuqinisekisa uba siyazama urhawurhawula lo mlilo wedobo. Lo mcimbi webhedi njengoba siwucacisa, iibhedi sinazo ezibhedlele kwaye sizongezile iibhedi ezinabo nobuxhakaxhaka obufunekayo bokuncedisa abo bafuna ukuncediswa nge-oxygen njalo njalo. Amanani njengoba besiwachaza, sinento epha more than 2,000 yeebhedi ezikhoyo ezingenabantu kwizibhedlele zethu. So sizama ukuthi ebantwini abantu mabeze ezibhedlele, but xa ngaba iibhedi ziphelile kwi-private hospital ayizuthetha ukuthi iibhedi ziphelile e-Eastern Cape. Siyabacela abantu nale nto yokucinga into kokuba isibhedlele yi-private hospital, ukhetha ulala emotweni e-private hospital endaweni ububheke emakhiwane, it's a problem. So abantu mababheke kwizibhedlele zabo, izixhobo zokulwisana nale ntsholongwane ezikhoyo zikhona naphaya. Sizama ukuqinisekisa, that's why sisithi nalapha songeza noogqirha ke ngoku abaninzi ezibhedlele ukuqinisekisa uba akuzubakho esibhedlele kuthiwa sinagqirha njalo njalo. Sikhangela amanesi anezakhono nezixhobo ezifanelekileyo zosincedisa, amanesi anqabile anqongophele njengoba sisazi sibona imeko, kodwa senza unako ukuqinisekisa uba siyakwazi ukukhawulelana naloo nto. Iibhedi zikhona kwaye siyazongeza, zikhona nesizongezayo ngoku ezi besisebenza kuzo from first phase ku-public works esisebenza ngazo ziredi ziyanikezela. Kodwa kuyawuyazi into yokokuba uphuhliso lweli phondo kakade beluloko lukekelela ezidolophini. So iibhedi zizawuba khona ingakumbi kwezi dolophu zinkulu nezibhedlele. Mhlambi xa usiya kwezinye indawo phantsi koxinezelelo ufike ezibhedi ungaziboni kakuhle, kodwa sinazo iibhedi ngokweprovinsi yonke. Into efana siyayijonga ke ngoyi-management. If amanani ethu besakhula kakhulu ukuba singamthatha na umntu e-Alfred Nzo simse OR Tambo, singamthatha na umntu eChristiani simse e-Amathon, apho kukho khona iibhedi. Zonke ezo bhedi zezikarhulumente, ziibhedi zeprovinsi, ayizozendawo ethile. So indlela esisebenza ngayo kukuzama ujonga ezo nto ezo nokukhawulelana nezo ngxaki ukuqinisekisa into yokokuba siyayidudula, siyalwa nale ntsholongwane kangangoko, siyayinciphisa. Kodwa akho nto yogqithe into yokokuba kunqandwe ukosulelana kwabantu nale ntsholongwane. Bayeke abantu ukuhamba yonke indawo besasulalana ngale ntsholongwane. Uba bayaqhubeka, sawuqhubeka sibona amanani anyukayo kakhulu. Izifo ngezifo ezikhoyo apha eprovinsini zizo ezinegalelo elikhulu ukubonakalisa amanani aphezulu okubhubha kwabantu. Abantu bethu abaninzi njengoko kusazi bafuneka kufudukiwe apha bayosebenza kwii-mines, babe nezazifo zezifuba nentontoni, zezinye zezinto. Enye yezinto ekhawulezayo kule COVID kukuminxa abantu. iyakhawulezisa kwimeko enjengale. So zezi zinto ke ekufuneka abantu noko bezibonile beziqaphele. That's why sibabongoza abantu base-Eastern Cape. Makungosulelwa abantu kuba sifuni bantu abazawunganyangeki kuba benezifo ngezifo. Cacisile ugqirha apha into yokokuba ingakumbi xa une-comorbidity de zibe mbini zibe ntathu uwedwa, amathuba akho xa uthe wachaphazeleka makhulu kakhulu uba unganikezela. Abantu nethi umntu azive engamnandanga, akusekho nto ekuthiwa hayi ndinefiva. Ubuziva unomkhuhlane, vuka uhambe ubheka esibhedlele, ucele uthestwa esibhedlele nje kuba unomkhuhlane. Ayikho into ethi lona umkhuhlane ngowe-COVID, lona umkhuhlane asingowe-COVID, ayikho lona. So masiqinisekise nje uba wonke umntu i-capacity yethu yotesta abantu ikhona, siyayazi ii-laboratories zethu zaye zaqiniswa ngakumbi, ziyawenza lo msebenzi lo. So abantu bakuthi mabayamkele le nto yokokuba nethi uziva ungamnandanga, khawuleza uyotestwa so that sikwazi ukukuncedisa ngokukhawuleza okukhulu, ungadanga wafuna ne-ambulance, uzizela nangokwakho, sikunike indawo, sikusapote, sikujonge uba yeyiphi into ofuneka uba kanti sikuncedisa ngayo. So siyabacela kakhulu ke abantu bakuthi noko basebenze nathi, basincedise ke kakhulu ke kwezinto ezinjengezo. Enkosi.
Especially the youth.
Into eyenzekileyo kule second wave esiye sayibona iqhubekeka noko yasenza uba noko sibe nokuxhalaba into yokuba abantu especially abantu abatsha banalento kuthiwa yi-risk perception kuba kuthiwe ngu-level 1 abantu bacinga uba hayi ayisekho ingxaki. Actually yiyo into eyasivusela umnyele we-COVID second wave. Okwesibini is that ukuthi because abantu abaninzi ngoku kule game bebeseyunivesithi, besezikolweni, behamba izikolo. Now i-COVID ngendlela esulela ngayo abantu abasebatsha ababonika impawu zokuba bayagula bona, bahamba beqhubekeka bengaziva impawu, kodwa loo nto ithetha uba ayibanqandi uba bangasuleleki abantu. Bathi bawufika emakhaya kootatomkhulu noomakhulu abebengaqondi uba unyana nantsika nomzukulwana unesifo bafumane i-COVID ngolo hlobo. Into esiyasixhalaba kwakhona yinto yokuba ke abantu bathatha ixesha elide beze esibhedlele. Umntu ufika noko sephelelwa ngamandla angakwazi ukuqhubekeka, angakwazi ukuba makabe nalo igalelo lokuba ezi zinto sinazo ngoku zokunika i-oxygen ngexesha eyenza uba isifo sijike, ukufumana amayeza athile anqabile for i-COVID eyenza ukuthi ingabhekeli ngaphambili, ukufumana i-oxygen ephezulu eyenza uba umntu angabi noko angoyisakali. Loo nto nxa ufika late awufumani. So into kakhulu njengopremier esitsho yinto yokuba masithi especially apha batsha xa siya ezipatini siya nakwezi rave sibeka ebuchengeni abazali noomakhulu emakhaya. Thina njengabatsha asibonakalisi ukuba sinengxaki okanye into yoba abanangxaki yoba baphelele esibhedlele. So yiyo nto ibalulekile kakhulu ke loo nto le nxa sizama noko ukukhusela abantu abadala.
So there's a laptop then. So there's a different.
Okay.
Can you hear him?
Unbonaphi?
We cut it in.